in the world of business. The government is calling on the private sector to take advantage of opportunities in healthcare, even as the Jubilee administration targets to deliver a better health sector. The health sector is set to kickstart a campaign to test the efficiency of basic healthcare in counties like Kisumu and Nyeri, where cases of preventable diseases are reported to be extremely high.
Doing its best to deliver on its promise. And I think for us in private sector, we know many times some of the best laid plans are not fulfilled because nobody got a full explanation about what that plan was and what their responsibility in the delivery of that plan is.
The reason we are taking on the primary care approach is in realizing that if we are able to sort out some of these issues at the village level, by way of getting the right information to the people, emphasizing that they need to behave in a certain way because the health outcome is going to be X, Y, Z, it is then possible we are able to bring down the disease burden in some of these areas. The reason we have picked Nyeri as one of the pilot counties is because the highest diabetics rate in Kenya is in Nyeri as a county.
Speaking of Big Four, it is almost every Kenyan's dream to own a home, but access to cheap, affordable housing has been more of a pipe dream for many Kenyans. But wait a minute, will the new push by government to build 1 million affordable units be the magic bullet to the country's housing puzzle? ATN's Ashley Mazuri fishes for some answers from a developer.
It's no secret that owning a home is increasingly a priority for many Kenyans who want to exit out of the rent-paying cycle. A new narrative by the government seems to be causing a stir. Under the Big Four agenda, the state plans to build cheap homes that Kenyans can buy. Although this is seen as a step in the right direction, one wonders, why is owning a home such a task?
Financing a bit high, so majority are not able to afford the cost of financing a typical mortgage to be able to access a housing. The other aspect will be generally on the other side of development, land cost very high.
The government, in its ambitious housing plan, aims to build 1 million homes by 2022 through two programs, social housing and affordable housing. The government will also work in partnership with financial institutions, private developers, manufacturers of building materials and cooperatives to deliver homes faster and reduce the cost of construction by at least 50%. Critics have, however, pointed out that the implementation timelines are unrealistic.
Although we are late, according to the whole process, we need to have done at least 200 units this year. It might delay a bit, but in development and with proper structures, funding being there, we can always recover this time.
Despite efforts by the government, they still need to look into some of the legislative instruments, a section of the Property Act and proper frameworks put in place to set the project on track.
There's a number of legislation, as you say, that needs to be looked into. There's the section of Properties Act that needs to be looked into. There's the whole thing about Stamp Duty Act that needs to be looked into.
During the 2018-2019 budget reading, the Big Four agenda was allocated 460 billion shillings. Out of this, construction of affordable housing received 6 billion, with 3 billion for construction of affordable social housing units and 1.5 billion for the construction of police and prison officers' houses. Despite critics coming out to say that the timelines are unrealistic, many Kenyans still believe that the implementation of the affordable housing pillar is still a step ahead towards achieving the Kenyan dream. Ashley Mazuri, KTN News.